About 1 in 3 Singaporeans die from either a heart attack or stroke on a day-to-day basis. A lot of Singaporeans also suffer from diabetes, hypertension, hyperlipidemia, which puts them at increased risk of a heart attack and stroke. So what we are trying to achieve is try to optimize their risk factors as best as possible. Current cardiovascular risk assessments include risk scores such as Framingham risk score, ASCVD score. They utilize traditional health information such as lipid panel, gender, smoking status, blood pressure, which may not really reflect the underlying cardiovascular status, causing it to be less precise. Cardiac CT scans for cardiovascular risk assessment, though more accurate, present significant challenges due to radiation exposure, long wait times, and high costs. Recent advancements in deep learning systems have shown promise in medical imaging, particularly in detecting retinal changes that could signal cardiovascular risk.
So it's been long known in medicine that the eye is a window to the cardiovascular and neurological system because they have a similar embryonic origin. Therefore, changes in the blood vessels in the eye can reflect damage that occurs in the heart or the brain. The advantage of ocular imaging is it can be done non-invasively. It is easy to take a picture of the eye that can let you visualize the blood vessels directly. We have developed artificial intelligence algorithms that allows us to analyze retinal images and predict the risk of cardiovascular disease in patients.
There are 2 screening tools that we have developed, Retical and SIVA-DLS. The first screening tool, Retical, predicts the probability of the presence of coronary artery calcium in retinal fundus images. This is an indicator of the risk of cardiovascular disease. The second screening tool, SIVA-DLS, automatically measures retinal vessel caliber from fundus images, which are correlated with cardiovascular disease risk factors and associated with cardiovascular events. We also use information on user demographics, medical history, and lifestyle to personalize the risk stratification by Retical and SIVA-DLS.
High-risk patients identified through these assessments will receive follow-up care and management at National Heart Centre Singapore to mitigate their cardiovascular disease risks. For example, optimizing their medical therapy, undergoing further functional testing, or anatomical tests such as CT coronary angiogram or cardiac coronary angiogram. Whereas for patients at high risk for vision-threatening diabetic retinopathy, they will receive specialized care at a DMC retinal clinic.
We hope that the screening tools we have developed are cost-effective solutions for healthy aging, disease management, and reduction of cardiovascular morbidity.
Our long-term goal is to implement this tool across the national screening program. This will allow us to identify patients at high risk early and reduce the mortality and morbidity from cardiovascular disease across Singapore.